In these times of economic hardship, many are turning to the National Health Insurance Scheme to take care of their healthcare costs. But with the NHIA owing service providers and health facilities asking patients to bear the full cost, the minority say deaths may be inevitable.
Under the current economic conditions, more Ghanaians than ever before will require the National Health Insurance Scheme to finance their medical needs. It is therefore unconscionable for government to hold on to monies collected in the name of the National Health Insurance Authority, rendering it incapable of meeting its obligation to service providers. This is going to increase mobility and mortality across Ghana. As we speak, patients in some hospitals across the country are being asked to make upfront payment for medical consumables and services. This is likely to increase mobility in persons with hypertension, diabetes, sickle cell anemia, HIV, and other conditions who require regular intake of medical consumables and services, resulting in undue stress on already overburdened medical facilities.
According to Kwabena Minta Kando, there seemed to be a deliberate attempt on the part of government to collapse the National Health Insurance Scheme.
Unfortunately, there rather seems to be an unwavering effort to collapse the National Health Insurance Scheme by depriving it of funds. As we speak, the highest release of National Health Insurance levies collected was in 2016, when 86 of the collections were released to the National Health Insurance Authority. The lowest on record is that of last year, where government, out of the 2.056 billion it collected, paid only 127 million, or 6.2% to the National Health Insurance Fund.
Meanwhile, Health Minister Kweku Agyeman admitted delay in the payment of claims, which is forcing service providers to pass on the cost to patients. He, however, assured Parliament that the NHIA is working to improve on its claim payment systems.
Co-payments or top-ups are not part of the payments at the moment. However, it persists, and the following have been given as some of the reasons for its occurrence: delays in claims payment, perception of unrealistic tariffs, and irregular review of tariffs, medicines, and services. The practice has led to member dissatisfaction of the scheme, and the common language being the NHIS is not working. In addressing the issue stated above, Mr. Speaker, the NHIA is collaborating with the Ministry of Finance to ensure regular reimbursement to service providers. There will be regular reviews of the tariffs in response to economic conditions.
Only a few days ago, the Pharmaceutical Society threatened that exactly this was going to happen. It appears the providers have started demanding co-pays directly from patients. It is yet to be seen what the experience of the ordinary patient will be in the various health facilities. But just as you heard the minority say there, this is going to lead to unnecessary deaths, and I've been calling on the Finance Ministry to release payments for the National Health Insurance Authority to be able to pay the service providers. Reporting for Joy News, Kweku Asante from Parliament House, Accra.